Asthma is a long-term condition that affects the lungs. It makes breathing difficult. Imagine your airways, the tubes that carry air in and out of your lungs, getting narrower. This narrowing makes it harder for air to flow, leading to breathing problems. Asthma is a common condition. It affects millions of people worldwide, both children and adults. While there is no cure for asthma, it can be managed effectively with proper treatment and care. Living with asthma can be challenging, but with the right knowledge and support, individuals with asthma can lead full and active lives. Understanding the basics of asthma is the first step towards taking control of this condition. By learning about asthma, you can make informed decisions about your health or the health of a loved one. Recognizing the signs and symptoms, understanding the triggers, and seeking appropriate medical care are essential for managing asthma effectively. Asthma severity varies from person to person. Some individuals experience mild symptoms occasionally, while others have more frequent and severe episodes. Doctors categorize asthma into 3 main levels of severity: mild, moderate, and severe. Mild asthma is the most common form. People with mild asthma may only experience symptoms a few times a week. Their symptoms are typically triggered by specific allergens or irritants. Moderate asthma is characterized by more frequent symptoms. Individuals with moderate asthma may experience symptoms daily, especially at night. They may also have difficulty with exercise or physical activity. Severe asthma is the least common but most serious form of the condition. People with severe asthma experience persistent symptoms that significantly impact their daily lives. They may have frequent asthma attacks and require regular hospital visits. Understanding the severity of your asthma is crucial for determining the appropriate treatment plan. Your doctor will assess your symptoms, lung function, and medical history to determine your asthma severity and develop a personalized management plan. To understand how asthma affects breathing, imagine your airways as flexible tubes that carry air to your lungs. During an asthma attack, these airways become inflamed and irritated. This inflammation causes the muscles surrounding the airways to tighten, leading to bronchospasm. As the airways narrow, it becomes harder for air to pass through, making it difficult to breathe. The lining of the airways also produces excess mucus, further obstructing airflow. This obstruction leads to the characteristic symptoms of asthma, such as wheezing, coughing, and shortness of breath. Over time, repeated inflammation can cause permanent damage to the airways. This damage can lead to a decline in lung function and increase the risk of severe asthma attacks. Therefore, early diagnosis and effective management of asthma are essential to prevent long-term complications. Asthma triggers are substances or conditions that can irritate the airways and trigger asthma symptoms. Identifying your personal triggers is crucial for managing your asthma effectively. While triggers vary from person to person, some common culprits include allergens, irritants, and respiratory infections. Allergens are substances that trigger an immune response in the body, leading to allergic reactions. Common allergens that can trigger asthma include dust mites, pollen, pet dander, mold, and cockroaches. Irritants are substances that can directly irritate the airways, causing inflammation and bronchospasm. Common irritants include tobacco smoke, air pollution, strong odors, cold air, and exercise. Respiratory infections, such as colds, the flu, and sinus infections, can also trigger asthma symptoms. These infections can irritate the airways and make them more susceptible to other triggers. By identifying and avoiding your personal triggers, you can significantly reduce your risk of asthma symptoms and exacerbations. Keeping a diary to track your symptoms and potential triggers can be helpful in identifying patterns and developing an effective avoidance strategy. Section 5. Recognizing asthma. Common signs and symptoms. Asthma symptoms can vary from person to person and may change over time. However, some common signs and symptoms to look out for include wheezing, coughing, shortness of breath, and chest tightness. Wheezing is a high-pitched whistling sound that occurs when you breathe, especially when exhaling. It is caused by air trying to pass through narrowed airways. Coughing is another common symptom of asthma. Asthma-related coughs are often worse at night or early in the morning. They may be dry or produce phlegm. Shortness of breath is a feeling of not being able to get enough air. It can occur suddenly or gradually and may be accompanied by chest tightness or pain. Chest tightness is a feeling of pressure or squeezing in the chest. It can make it difficult to take a deep breath. If you experience any of these symptoms, it is essential to see a doctor for diagnosis and treatment. Early diagnosis and management of asthma are crucial for preventing serious complications. Section 6. Managing asthma. Taking control of your health. Managing asthma effectively involves a combination of medication, lifestyle modifications, and trigger avoidance. Your doctor will work with you to develop a personalized asthma action plan that outlines the steps to take to control your symptoms and prevent exacerbations. Medications are the cornerstone of asthma treatment. They work by reducing inflammation and opening up the airways. There are two main types of asthma medications: quick relief medications and long-term control medications. Quick relief medications, such as albuterol inhalers, provide immediate relief from asthma symptoms by relaxing the airway muscles. Long-term control medications, such as inhaled corticosteroids, are taken regularly to reduce airway inflammation and prevent symptoms. Lifestyle modifications can also play a role in managing asthma. Maintaining a healthy weight, getting regular exercise, as tolerated, and avoiding smoking are essential. It's also crucial to manage stress, as stress can trigger asthma symptoms. Trigger avoidance is another critical aspect of asthma management. By identifying and avoiding your personal triggers, you can significantly reduce your risk of asthma symptoms. Keep your home and work environment clean and free of allergens, avoid exposure to irritants, and stay up to date on your vaccinations to reduce your risk of respiratory infections. Section 7. Exploring different types of asthma. Asthma is not a one-size-fits-all condition. There are different types of asthma, each with its own set of triggers and characteristics. Understanding the different types of asthma can help you and your doctor develop a more targeted treatment plan. Allergic asthma is the most common type of asthma. It is triggered by allergens such as pollen, dust mites, and pet dander. People with allergic asthma often have other allergic conditions, such as eczema or hay fever. Non-allergic asthma is triggered by factors other than allergens, such as respiratory infections, cold air, exercise, or stress. Occupational asthma is triggered by substances encountered in the workplace, such as chemicals, dust, or fumes. In addition to these main types, there are also subtypes of asthma, such as cough variant asthma, which is characterized by a persistent cough as the main symptom, and exercise-induced asthma, which is triggered by physical activity. Section 8. Advanced treatment options, bronchial thermoplasty. For people with severe asthma that is not adequately controlled with medication and lifestyle modifications, advanced treatment options may be considered. One such option is bronchial thermoplasty. Bronchial thermoplasty is a minimally invasive procedure that uses heat to reduce the amount of smooth muscle in the airways. This reduction in muscle mass helps prevent the airways from constricting during an asthma attack, improving airflow and reducing symptoms. During the procedure, a bronchoscope, a thin, flexible tube with a camera and a heating element, is inserted into the airways. The heating element delivers controlled bursts of heat to the airway walls, reducing the muscle mass. Bronchial thermoplasty is typically performed in a series of 3 outpatient procedures, spaced several weeks apart. While bronchial thermoplasty is not a cure for asthma, it can significantly improve symptoms and reduce the need for medication in some individuals with severe asthma. Section 9. Living well with asthma. A lifelong journey. Living with asthma can be challenging, but it doesn't have to control your life. By taking an active role in managing your condition, you can live a full and active life. Work closely with your doctor to develop a personalized asthma action plan and follow it diligently. Take your medications as prescribed and monitor your symptoms regularly. Identify and avoid your personal triggers to minimize your risk of asthma attacks. Keep your home and work environment clean and free of allergens, and avoid exposure to irritants. Stay informed about asthma and the latest treatment options. Knowledge is power, and understanding your condition can help you make informed decisions about your health. Remember, you are not alone. Millions of people worldwide live with asthma, and there are resources available to support you. Join an asthma support group, connect with others online, or reach out to your local asthma organization for guidance and encouragement.